Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about closed pack position. The closed packed position is a very specific position you can place a joint in so that the entire joint is the most congruent and most taut. And congruent means how well the structures fit with each other. Structures meaning the articulating surfaces of the bones. This position is the most congruent, so out of all the angles in the joint, this is the one that fits the most tightly and snug with each other. And to make this happen, the surrounding soft tissue structures of the joint, so think about the capsule, ligaments, etc., these all need to be in a position that makes them extra tight so that they can hold the bones in place. If these surrounding structures were not here, our bones would just be floating in space. So it's because of these surrounding soft tissue structures being tight that we get this congruence. Now, as I mentioned before, this is a position. This is not a movement. It is a static position. So for example, the humeroradial joint. Let's talk about its closed pack position. This is specifically when the joint is placed at 90 degrees flexion with 5 degrees supination. If we were in 90 degrees flexion and 10 degrees supination, then this would not be considered the closed packed position. So let's talk about what I mean when I say taut. Now, imagine the anatomy of our tibiofemoral joint, so the knee. In your head, you can picture the femur bone and the tibia bone and where they connect. But of course, we also have structures like the meniscus and the ACL, PCL, MCL, LCL. There's a capsule surrounding the joint, so there are other tissues as well. Now, as you're flexing and extending the knee, even if you're just doing it yourself, you're going to find that there are certain regions within the range that feel a little bit more tight than others, and others seem a little bit more loose. And when I say loose, I'm not talking about instability, but maybe you kind of feel a little bit less pressure. So if I have my knee, and I'm doing it to myself, if I have my knee completely extended and my screw home mechanism is turned on, so I'm at end range with my tibia externally rotated, this to me feels very tight. But then if I relax a little bit and allow my knee to bend slightly, it feels a lot looser and it almost feels like there's kind of some room to breathe. But if I continue to flex my knee at its very end range, it kind of starts to feel similar to how it feels at end range in extension. It feels like it's super tight again. Now this first position that I mentioned, the one where my knee feels really tight, it is at its end range in extension with the screw home mechanism on. This is actually the closed pack position of the knee. So this is the very specific position that we can place our knee joint in so that the space between the femur and the tibia, this is the smallest distance, the smallest amount of space. So what I mean is that if I took an x-ray of your knee at 25 degrees of flexion and I compared it to an x-ray of your knee at 0 degrees of extension, so this position, you're going to see that there's a literal physical difference in the amount of space that there is between the two bones, the tibia and the femur. So if I'm at closed packed position, this is the smallest distance that you'll ever see. It's smaller than 25 degrees of flexion, 24 degrees of flexion, 1 degree of flexion. It doesn't matter. 0 degrees of flexion is where the two bones have the smallest amount of space between. Space. If it's a small space, that's why it feels so tight. Don't forget about the other structures. We don't just have two bones floating in space. What holds us together are our ligaments, our capsules, all these surrounding soft tissue structures. So when our tibia and our femur are the closest together, this is because of how tight the surrounding soft tissue structures are. If the capsule is tight, it's going to hold the bone together. If the ligaments are tight, it's going to hold the bones together. These being tight pull the two bones together. Even though we've been using the tibiofemoral joint as an example, just understand that every single joint that we have in our body is going to have its own unique closed packed position. And it's unique because it's going to depend on the shape of the joint, the position of the surrounding structures, how much free range the joint has, among other things. So that being said, just because the knee joint's closed pack position is at 0 degrees, that doesn't mean that it's at 0 degrees for the shoulder or the DIP or the MCP or whatever it is. They're all going to have a very unique closed pack position. So how do we know of what each particular position is with all these joints? And I'm not talking about in terms of memorizing. I'm talking about, how as a professional do we even come up with this? It's all based on research. some other really incredibly smart clinicians and researchers did all of this work, and they studied anatomy and they studied biomechanics, and they found the answer for us. So as annoying as it is to have to sit down and make some flashcards to memorize these things, I'd say doing that is a lot easier than what they had to do with respect to finding out, all this research. They did all the work for us. We just have to make sure that we use it. Now, what about the application for this concept? We don't just learn it just to learn it, just to know it. Well, we can actually apply it for when we are in the clinic. So I hope you enjoy my interpretation of how I depicted a knee joint looking like with an ACL graft. So what I would like you to do is look at the left side of the image first. I want you to imagine that you're seeing a patient following an ACL surgery. Now, generally, we have these people locked in extension for a few weeks while the graft is healing. So it's, something to memorize that we have to, have our patients locked in extension, but it's another one to understand why we have them locked in extension. So we know that the knee is in extension, and this is the closed packed position. I want my ACL to heal in this closed packed position because once it heals all the way, the ACL will be the shortest possible, and it'll actually be able to do its job of resisting tibial translation anteriorly. Now, let's say that our patient has not been following their protocol and they've taken their brace off, or they're walking and they're not keeping their knee locked in extension, so they're not keeping it in this closed packed position. So this is the situation where we move to the right side of the dotted dashed lines. So now we're starting on the left side of the right side. Here we're showing that the patient is maybe about 15 or 20 degrees of knee flexion. So as we talked about, we know that any position outside of full knee extension is not going to provide the most taut position. So even at this 15 or 20 degree range of knee flexion, the ACL is going to be pulled a little bit. So it's going to get a little bit longer over time. Now when we put this knee back in extension, if it's healed this way, you're going to notice that there are little squiggly lines that I drew between the two bones. And this is suggesting that in this more taut, more congruent position, the ACL is now a little bit more lax in this position. We don't want this because the job is to be taut. The ACL's job is to resist a pulling movement. But because it's looser, because we've been hanging out in that 15 to 20 degree range, because it's looser, we're going to provide some give, unfortunately. So essentially, we can use this knowledge of what a closed packed position is to provide for optimal healing following surgeries or sprains or strains or anything like that. If you enjoy material being taught this way, check out our content at sptwithme.com when you're studying for the NPTE.